A recent conversation with one of my patients who has kidney disease brought to light how she felt on hearing the reactions and comments of her friends and relatives. Even with the best of intentions, we can sometimes say something that can genuinely hurt and upset a patient. Today, I want to share with you phrases patients do not usually appreciate. 15 odd conversations you should not start with a kidney patient. The difference between sympathy and empathy. Sympathy is, what happened? How did you get diagnosed? Although you're showing your concerns, every person visiting a patient inevitably asks these questions. The patient or his family member has to repeat the same story again and again, which may drain them emotionally. Empathy is, it must have felt like a shock being told of the diagnosis. Sympathy is, how did you get it? You look so healthy. A patient might perceive that you are blaming him or her for getting the disease. Looking well or having medical diagnosis are two different things. No one wants to be ill, so asking them why they got it or why they didn't know earlier is a way to blame them for the disease. Empathy is, I'm just as surprised as you are to hear this news. Sympathy is, just let me know what you need. Don't say it if you don't mean it. And if you genuinely want to provide any assistance, be proactive and take initiative. Tell her the times or the days you can help her. Empathy is, I have time second Monday of the month. I can take you for your dialysis at that time. Sympathy is, look at the brighter side, you could have cancer. Comparing one disease with another one doesn't help in providing assurance. Empathy is, nobody really knows what it's like living with a disease on a day-to-day basis. Sympathy is, drink more water. Your kidneys will start functioning normally. I know someone who was cured like that. Snap recommendations of a cure or treatment, especially when not reasonable, or more about treating our own anxieties rather than the patient's. Empathy is, this illness has a lot of complicated issues, including diet and treatment. There's a lot to keep in mind. Sympathy is, why did you not tell me about your condition earlier? It takes time for a patient to come to terms with her disease, and everyone has a different way of handling a situation. While one patient may want to email even her distant relatives or friends, others may want to shut themselves away from the world for some time. Empathy is, I'm glad you shared this news with me, and you can count on me to share or not to share it. Either way, I'm with you. Sympathy is, did you take your medication? Tell me, what medications are you taking? Let her or her caregiver take charge of the situation. They are already overwhelmed with this new event in their life. Further advice and suggestions can make this time even more difficult for them. Empathy is, do you have enough information with all the treatments? Can I help you in any way? Sympathy is, have you got a kidney donor? What are your chances of survival? Speaking of survival, may aggravate anxiety. Empathy is, don't ask them intrusive questions. The patients will let you know what and how they want to share this information with you. Perhaps a gentle opening line might be helpful. Sympathy is, I couldn't control myself from crying over your situation. We visit patients to talk about his, not our emotions. Although we may be deeply troubled by the complications of the patient's disease, it is usually best to let the patient share his feelings with you rather than the other way around. Empathy is, I had a feeling you would be upset when you heard this news. Sympathy is, my father's brother's son-in-law's friend was diagnosed with this kidney failure. Let me tell you his treatment and the experiences in detail. Even with the same level and type of disease, the emotional and physical effects on each patient are unique, and thus no two patients can be compared. Empathy is, would you like to speak with someone who has similar issues? Sympathy is, I just can't believe you have kidney failure. I just saw your Instagram profile. Where were you vacationing? In Bali? And you look so healthy. Not everyone wants to publish a Facebook, Instagram, or Twitter post about their diagnosis. If they do, it is perfectly reasonable. Don't judge a person by how he behaves, looks, or updates his online profile. Every disease brings psychological and physical changes that may not be noticeable by others. Empathy is, it must have come as a shock after that wonderful trip you documented on your post. Sympathy is, why didn't you show your report to Dr. X for a second opinion? The bond of a patient with his or her caregiver is profound, filled with all kinds of confusing feelings, ranging from deep trust to outright mistrust. The offer of a second opinion may aggravate any of those feelings. Empathy is, if you ever feel that you may be interested in a second opinion, I can help you arrange it. Sympathy is, you'll be fine. With significant kidney failure, life will never be the same. It will be a new normal, and life will be very different compared to that before. Cultivating dismissal of the fact doesn't change the facts. Empathy is, you will have a lot of ups and downs, and I'm here for whatever you need. Sympathy is, I know how you feel. No one but the patient knows how he feels. Empathy is, I can't imagine how you feel. Sympathy is, have you made out a will or power of personal care? It is best to wait for the patient to start discussing this topic with you, if he wants to. Otherwise, it may feel like an intrusive comment. Empathy is, have you discussed your condition with close family members? To support a patient who has kidney disease, it is more helpful to them if your conversation has an empathetic rather than a sympathetic approach. Visit our website, psychonephrology.com, to find more resources.